line of work often comes with nicknames and that kind of thing. I mean, people think that all we do is toilet people, change people, clean them up, and that's it. And it's a lot more than that. I mean, we care about these people. We take care of them, and we care for them.
It also makes us feel really good. I mean, not to be selfish, but
right.
There's nothing like the feeling of knowing that you've helped make somebody's life a little easier, especially when they couldn't do it on their own. Or so we do have some people that have no family at all, and that they're getting some love in years that they might not have gotten any at all otherwise. So it's a big deal.
If the CNAs were not here, I would be in a lot of trouble. They do things for me that I simply cannot do anymore. They're like family members.
Less than a year and a half ago, my wife was at this facility, and she also was adequately cared for by the staff. It was important for me, as we family members came and went from the facility, to realize when we stepped out how well she was cared for.
Direct care workers provide the hands-on care for millions of Americans that are aging and with disabilities, but unfortunately they often go without health care coverage for themselves, and the health care coverage, if they are offered it, is usually unaffordable or inadequate. PHI's Healthcare for Healthcare Workers campaign is dedicated to improving healthcare coverage for this workforce. By doing so, we make this workforce more stable and improve the quality of care.
The influence that we've begun to have with policymakers has also been made possible in part by support from the Atlantic Philanthropies. What we've seen happen is that legislators, policymakers, everyone, they're finally starting to talk about access to health care and the workforce in the same sentence.
It was been a great experience for me to come in and job shadow a couple of the direct care workers today.
They work hard, don't they?
They do, they do. And you can watch it on TV or you can read about it, but until you really actually do the work, you don't really understand all that's involved.
This is an occupation. They're paraprofessionals and they need a good wage. They need benefits to go along with that, and we really feel that that's pretty important. They also need the recognition from not just the families and the residents, they get lots of that, or from myself, it's from the community.
I feel our job is important because we all get old. Everybody's going to get old. Everybody's going to need to be taken care of at some point. And one of the things that we try to do is take care of people the way that they want to be taken care of.
Former First Lady Rosalind Carter once said that in our lifetime we're all going to either become a caregiver or we're going to need a caregiver. That's why it's all the more important to give these direct care workers the resources they need to care for the ones that we love.